Welcome to Ed Talks. So thrilled that you could join us for this particular episode. And it's a pretty cool one. I've my friend Mandy Ghias, Dr. Mandy Ghias, joining us today. So, Mandy, welcome to Ed Talks.
Thank you. Thanks so much for having me. It's a pleasure to be here.
Yeah, so self disclosure, I serve as an advisor to Tono Health, and Mandy's one of the co-founders along with her husband Bryson. And it's pretty amazing the things that they do. And I thought, wow, this would be super interesting, not just from what Tono Health does, but just sort of the what it takes to be a founder and a leader and make things happen and being a physician at the same time, uh, practicing and all that kind of stuff. So it'd be a really interesting conversation. And Mandy, as you'll find out, is a pretty fascinating person. So that's really how we met, was really through Tono Health. So we've been working together for about 6 months or so, and it's been a really unique experience to date. So really thrilled. And so, Mandy, I wanted to ask you just generally customer experience. What was the best customer experience you've had recently? And it could be across anything, it doesn't have to be healthcare.
Mhm. Yeah, I mean, we've had a lot of phenomenal patient experiences, but one that definitely stands out is we have a patient with severe HS. So HS is a condition called hidradenitis suppurativa. Very briefly, it's a chronic inflammatory skin condition that, is characterized by these really painful abscesses and nodules. It's very progressive and debilitating, and it usually affects the underarms, the groin, buttocks, so very sensitive areas, so huge impact on patient quality of life. And so this patient had really severe HS, and she had it had such a huge impact on her life. Like, she was in 10 out of 10 pain most days, and really severe diabetes that was poorly controlled to the point that she couldn't get surgery to help her HS. And by seeing her through Tono, we were able to get her started on a really comprehensive treatment plan that included everything from biologics, daily IV infusions, and we're able to get her to a point that she was able to have surgery, and her outcomes have been absolutely incredible. Instead of messaging us about recent flares, now she sends us photos of her paddle boarding, or during our recent follow-up appointment, she was telling me about how she's now, starting to take violin lessons. And just compared to where we were at this point last year, it's just a complete 180, and it's been really incredible to see.
Yeah, that's amazing. And yeah, I did look up that condition, and the fact that you were able to help her and achieve that sort of lifestyle she's enjoying now is pretty incredible. So that's cool. What's one thing, just trying to get to know you a little bit better. What's one thing that maybe your parents forced you into that at the time you were like, oh my gosh, I don't want to do this. But now as an adult, you look back and say, oh, I'm glad they sort of made me do that.
Yeah, I would say mine is definitely working at the NIH. So, growing up, I grew up in the DC area down the street from the NIH. And basically, every spare moment of life from the beginning of high school onwards, I was at the NIH. My mom was a scientist there, and she actually recently passed away this last year. So it's been, really top of mind for me to think about, like, the life lessons that she taught me. And I'm so thankful that she really passed down this love of science and medical innovation, because it's been incredibly influential, and it inspired me to eventually work with two giants of the field, Dr. Potter, who won the Lasker Award, and Dr. Greengard, who was a Nobel laureate. And working alongside these legends was really what inspired me to value the importance of creativity and pushing the realm of possibilities in medicine.
Yeah, that's really cool. And yeah, I'm sorry about your mom. And it sounds like she was a great great individual and a great scientist, and helped propel you to who you are today in your vocation. So that's pretty cool. Can you tell us a little bit more about yourself? So like your last name, ethnically, like where's kind of your roots?
Yeah, so my last name is Persian. So, my entire family is Persian. I grew up speaking Farsi, so English was my second language. And yeah.
Yeah, that's really cool, guy. You may be our first Persian guest, and it's certainly a beautiful part of the world, and a lot of I can't remember the names of the science that came out of there, but a lot of great art and science as well that have influenced the life that we live today. So it's pretty cool. So let's talk about Tono. Why was Tono created?
Yeah, so we started Tono to really increase access to best-in-class specialty care, starting with dermatology. My background, I'm a dermatologist. I focus on chronic inflammatory skin conditions, namely HS, as we discussed, as well as skin of color dermatology and teledermatology. And, with given the really visual nature of dermatology, it's incredibly well suited to virtual care. And, there are a lot of subspecialists within the field, and, so there's very few doctors that focus on conditions that impact, such a large population of patients across the US. And very few people can get access to that level of care. So, like the patient I discussed earlier, that type of level of specialization can have such a huge impact across the board. And so we started Tono to really increase access to this same level of care. So, now we're in 15 states. We're getting people across the US access to specialists that they need, starting with dermatology, but quickly expanding, to other specialties that are similarly well suited.
That's cool. Yeah, that kind sort of covers the mission and vision and the heart behind Tono. And yeah, that was a great example that actually kind of brings that all to life. How do you keep patient experience front and center? So, that's the big, and appropriately so, a big focus of healthcare systems in the last several years. And so, when you built Tono and the design around Tono, how do you keep the patient in the middle, in the center?
Yeah, so our goal was always to really take the best elements of in-person care and, that human element and that human experience, and to incorporate that into Tono's platform in a model that would, enable more patients to get access to that same level and quality of care. So, by having things like patient advocates and a care team, and building the technology to really implement and focus on those core elements, that's really been our main goal, and keeping the patients at the center of this. I think that it's really important that Tono is built and managed by doctors who are actively treating these patients, because I know I learned so much from every single patient experience, and you really stay connected to the problem, and you're able to foresee and troubleshoot and solve a lot of things that I think traditionally tend to get in the way of delivering that level of care, in some of these platforms where care is very disjointed.
Yeah, that's really cool. And what about the types of care that you can deliver virtually? And you touched on it a little bit, but I'm just curious because sort of what's that breadth and depth, of and then how do you see, is there times when you have to see the skin more closely, and how you do all that?
Hmm. Yeah, absolutely. So, with dermatology, a lot of it can actually be done virtually, especially because a lot of the new treatments that really evolved over the last 5 to 10 years. So, namely, the biologics and more targeted treatments that we have for conditions like psoriasis, HS, atopic dermatitis. That has really led us to a framework where, if we are able to get the patient's information ahead of time and, to have proper photos, which nowadays with, the camera quality, sometimes it's literally better than the human eye. Like there are times in clinic where we'll actually, take a photo and then go in a different room and like blow it up, and you can just see certain things that you may not have been able to perceive. So really just having that level of quality of the photos has been phenomenal. And yeah, so photos, live video visit, proper curated intake that's really designed for complex med derm is ideal. There are certain areas of dermatology, of course, that are not going to be really well suited, to a visual care platform. And so for those, we really partner with in-person providers and health systems to get those patients, care in person. So whether it's a biopsy, whether it is, a surgical procedure, or total body skin exams, I do think are still best managed in person, because you want to be able to, see and just analyze everything, as well as cosmetics. So for things that are more procedural, we partner with in person, and then the elements that can, the more chronic conditions can be better managed virtually.
Yeah, that's really neat. And I certainly appreciate virtual care, and I've really benefited from it, as everyone I know. I mean, it's just, to me, it's like it's just this natural thing. And it's great that, if I needed to get some, especially some subspecialty care, that we have this network that's easily to access and get that level of care. So
Yeah, I mean, I don't think it was always that way, but I really think that, because I feel like sometimes with healthcare, things move very slowly, and until people, experience something, which I think a lot of people, had the chance to experience with COVID, I think there was a lot of, hesitation or apprehension before that, but now it just, a lot of patients ask for televisits just because it's so much more convenient, like they don't want to have to take off work, they have more privacy. I mean, it's
yeah.
just, endless reasons, as you know.
Yeah, I even had, Mohs surgery, and all my pre appointments and post appointments have all been virtual. And like you said, the power of the camera is as better in many cases, like actually being there. And so I loved it. It's just made everything a lot easier. When we think about just being a founder and sort of digital, like how do you come up with your ideas? I mean, is it over a cup of coffee, a glass of wine? When you think of it, because you have to be innovative, you're an entrepreneur. So how do you sort of, come up with ideas, or, enhance the creativity?
Yeah, that is a very good question. I mean, I think it comes from a few different directions. I've been really fortunate to have incredible mentors and to work with other doctors that, and scientists that really inspire a lot of, the innovative drive, when it comes to, these areas of medicine that we're continually evolving every single day and staying on the, frontier and like cutting edge, because the outcomes of what is possible are so amazing. Things like melanoma, how we used to manage it has really changed so much in the last 5 years, and it changes every year, every month, and gets better and better. So it's been really amazing. That definitely has been a big source of ideas. And otherwise, I would also say, the patient experience. I think you can, again, learn so much and get a lot of ideas just by engaging and interacting with your patients, because they're your best teachers.
Yeah, clearly. And I like that approach. And then, yeah, so on the lines of sort of being a founder, is there anything in life that sort of prepared you, or you just sort of did it on the job? You kind of learned it on the go.
I mean, I would say it's probably a little bit of both. I don't know if there's one set thing in life that prepared me. I will say that, all of the challenges that you come across every step of the way. For example, a lot of the challenges that I saw my family experience in accessing and engaging with the healthcare system definitely was a source of inspiration. One of the reasons, I went into medicine, and also wanted to have a larger impact, on the field, because, health is so integral to every aspect of life. And yeah, and I think that there are endless areas for improvement in healthcare always.
Mm.
But yeah, I would say it's really, been a continual drive to expect and to work towards, a better system for our patients.
And if you had a physician colleague come up to you and who had an interest in doing a startup, being a founder, what's one piece of advice you might give someone, as they started or contemplated this journey?
I would say that it is, very easy as a startup to get distracted by, all of the noise in the world, and in a closer system. And so, it's easy to get sidetracked if you are listening to like every single recent trend that's going on. And so, of course, you want to be aware of what's going on and incorporate the aspects that are relevant, but you don't want to be doing everything, because then you're kind of doing nothing. So, just staying focused on the core goal of like, what are you trying to do and how do you do that? And, trying to minimize the extraneous distractions that may cross your path.
Yeah, that's good, really good advice. I think in life in general, but certainly, yeah, when you're starting something new. So we talked a lot of different areas. We talked in the beginning a little bit about Mandy, your background and your heritage, and then we talked about Tono Health and all the great things that you're doing. We gave some great patient examples and how you're all leveraging digital to enable this care so that everyone has access that and those sort of things, which you really help everyone, so no one's left behind. And then we talked a little bit about leadership and doing a startup. Is there something we missed or something we talked about that you wanted to emphasize? I'll leave you with the last word.
Sure. Yeah, I would say really just, the importance of increasing access to patients, because, and we've seen this so much with dermatology, that it's really, really challenging to access a specialist in a lot of areas of the US. I mean, patients are having to travel like 2 to 4 hours each way, just to be, then sit in a waiting room for a while. And, it's a pretty grueling experience for a lot of people. And just how can we make that better? How can we, improve diversity as well? Because a lot of patients, as we know, prefer to be seen by, maybe a provider of the same gender or race, ethnicity, and all of these things really, play a huge role in the patient experience, and that we are really working to improve that over time. One other thing that I forgot to mention is that we are expanding to endocrinology. So we just, onboarded our first group of endocrinologists, because somewhat similar to derm, endo is definitely well suited to virtual care, but for different reasons. I would say it's mostly because, it's a really lab and data driven area of medicine. But, so we're really excited about that as well.
Yeah, I think you brought up a couple points. One is that access is hard and not, and for a wide variety of reasons. and just the wait times, right? And I don't have the national average off the top of my head, but it can
Mhm.
be months. So
Yeah.
you got an issue and you go to your local hospital and you may wait a long time. I mean, that was wherever I've served as a CDO, chief digital officer, chief information officer. That was always one of the big challenges, like how do we reduce the time, the days to be seen. And it was pretty extreme. I mean, you're talking 60, 90, sometimes 120 days, depending on the particular specialty. And so this really breaks that down. And then, yeah, I was going to ask you about, wow, if you have this framework already for this specialty, you could certainly scale that to other specialties that are in a similar situation as you described. So it's so cool. That's why I was really interested in serving with you all, because it does fill these gaps that we've highlighted. And I was glad to see someone, wow, actually trying to tackle this and leveraging digital to do it. So bravo to you and your co-founder, Bryson. And I think you'll be super successful. So thank you for being on Ed Talks. I really appreciate it.
Thanks so much for having me.
All right, that wraps up Ed Talks. Thanks for joining us.